107.3 KFFM, Middays with Sarah J. And Mental Health Mondays are powered by Comprehensive Healthcare. It is their 50th anniversary. They've been celebrating all year, and they're going to continue to celebrate. They're thriving. Today, I have a very special guest in. I have got Jodi Daly from Comprehensive Healthcare. Jodi, what's your title?
I am the Chief Executive Officer of Comprehensive Healthcare and have been here in the community going on 5 years.
There was a message that Comprehensive Healthcare could spread to the community right now. What would you want to say?
You know, what I'd want to say is that we want this community to be a healthy and vibrant community. And the way that we can participate in doing that is by providing prevention services. And so there are a lot of services that we provide at Comprehensive Healthcare, like mental health first aid training.
Ooh.
And mental health first aid training is like first aid basic training.
Okay.
And it really gives people an idea how to intervene or assist others that look like they might be distressed.
That's a huge tool for anybody. How would they get that information?
By calling Comprehensive Healthcare, and or we have a website that is mhfa@comphealthcare.org.
And those are classes that are offered all the time?
Correct. They're classes that are offered all the time. They offer adult-specific courses as well as child-specific courses. And so currently we have 2 courses scheduled. One is for June 16th and one is for July 19th.
Are they free?
They are free. And I would really highly encourage any community agency or organization to participate. It really would benefit any employee. It certainly will benefit the schools right now, given the recent school shooting. I think it would really provide tools and a toolbox for teachers and superintendents, parents, and of course children can attend for the youth mental health first aid.
Right. So if you're listening to this right now and you've ever thought, what can I do? What do we do? This is a perfect starting point.
Absolutely. It's a perfect starting point. And it's a national evidence-based prevention tool.
Mm-hmm. You don't know until you're in those situations, and it can get really terrifying for everybody involved. The person who's having all of these extra emotions, and then the person who's taking this in knowing these are red flags, but I have no idea what to do with these red flags. So know that Comprehensive Healthcare is in the community. They are here to help, and there are so many different resources. So thank you for providing some of those resources. What else are you offering right now that you want to make sure everybody's aware of?
I always want to make sure that people are aware of the crisis line. And Comprehensive Healthcare has developed numerous crisis programs throughout the greater Columbia region and, of course, right here in Yakima. And that crisis line is area code 800-572-8122. Anytime you call a crisis line, someone is going to be available to really listen to your concerns, triage what might be happening, and immediately link you to someone that can assist you.
Perfect. So any questions about mental health, getting yourself to a therapist, there are so many different ways to get your mental health kind of, I like how you said triage. Crisis in our community, if you would be so kind to kind of list off some of those signs that maybe you're in a situation that you should be reporting to somebody who's a professional.
Sure. So I think any time that you have a neighbor, a family member, a parishioner, an employee, right, that has changed their behaviors in any way that you think may be causing concern, you need to reach out. So what are some of those things?
Yeah.
Right? Some of those things are people that are generally maybe consistent in their behaviors. They come to work literally at the same time every day. Nothing much ruffles them. All of a sudden is coming to work late, is leaving early, is kind of becomes unraveled on things that you have not seen them do that before. People who are giving away things is always, of course, a sign of concern. People who want to isolate in their homes, not go to work, or calling in sick a little bit more often, to include, right, school children who are wanting to stay home and stay away from school, stating they have headaches and stomach aches. We just need to be a little bit more in tune and kind of question things that seem out of the ordinary. And of course, we're all unique individuals, right? But those that love us, those that spend time with us, tend to kind of know when we're off a little. And when we're off a little, or we see someone being off a little, we need to start asking some clarifying questions about how they really are doing, or can we do something for them? And really opening up space where we can listen to people and giving them that safe space to be able to have conversations.
Now, would you be documenting it? Because I know people say, oh, I saw all these signs and then all of a sudden it just got out of control. The moment that you start noticing something, make note of that. You would approach them and you'd ask them, and probably 9 times out of 10, and I don't want to speak for people, but they're probably going to say, I'm fine, or blow it off. Once you have asked them these questions and you notice that it continues, that's when you need to contact a professional.
I think so. And the other thing that I would really recommend, it's not just about giving someone a number. It's really reaching out, right? It's reaching out and taking someone's hand and saying, I'll come with you. I will come with you.
Yes.
Let's both go to comprehensive health care. Let's go to your private practitioner. Let's go to Yakima Neighborhood Health. I don't particularly care where. The important piece is how do we connect with people and grab them by the hand and walk with them to wherever they want to go to ensure that they're engaging with a professional.
It is not weakness. Everybody has struggles, and everybody needs that person that says, okay, grab my hand. We're going to do this.
And I think even, that statement is so much more important now. We just all went through a pandemic, depending on how we portray it each day.
Right.
Is going away or not going away, right?
Yes.
But what's always interesting to me is the pandemic really, the number one feeling we all had during the pandemic is isolation. The interesting thing about isolation, it's a shared feeling. So every single one of us in our communities had some level of feeling that overwhelming piece of isolation, right? Now, the conundrum is it's a shared feeling, yet we all feel adrift still.
Yes.
And we're still we tend to work in silos, and we're still doing things in isolated ways. And this engagement, this discussion about just connecting with people, being kind, showing up, just literally showing up and sitting beside someone when they're not doing well is easily as important as all of the questions that you need to ask to make sure that they're okay.
So what about Washington State can we be really proud about when it comes to mental health?
This year specifically has been a banner year for mental health and substance use disorder legislation. And I am extremely proud of the representatives that serve all of our districts, because I'm here to tell you they were all in it to win it for us as it relates to policy, as it relates to increased funding, and then even for the future of pulling committees together so that we're always keeping our eye on behavioral health and how we can do it better. But this year, we saw a huge increase in the Medicaid rate, which I have never seen, frankly, happen. So the governor in the legislative session gave a 7% increase to the Medicaid rate and non-Medicaid rate, which was extremely helpful and will certainly help us recruit and retain individuals to work in our industry. Also, that they allowed $100 million for COVID workforce relief to be distributed to community-based mental health centers so that we can really, again, deal with recruitment and retention, because the workforce shortage is very real.
It's still continuing.
It's still continuing. So this allows us to do sign-on bonuses and relocation to really attract people to this wonderful area we all live in and to highlight it. So we're using, our money even on recruitment videos and partnering in the community to show off Yakima and the surrounding areas, right? We really want to encourage people to come and work with and for us, right? To assist us in making our community very vibrant and healthy. I just can't tell you how supportive they have been. I can't tell you how many calls I received during the legislative session for feedback and opinions on bills. We are really lucky to have a group of individuals that want to see an impact in our communities. They want to see our cohort group, those of us that suffer from mental health and substance abuse disorders, become productive members, can impact economically and socially in our communities. This was a great year to be in our industry.
I think that's wonderful. Yeah. So 50 years with comprehensive health care. You are expanding and growing and obviously adding to your team.
Mm-hmm,
so I'm sure, being that you are already in the mental health field, you probably have some cool bonuses to working with comprehensive health care. You get your own mental health game like top notch.
Absolutely. We have a ton of great bonuses, right? Or benefits, frankly. We have, EAP is certainly offered to all our employees employees. But we also do things like picnics in the summer and Christmas parties. There is team building dollars that go into encouraging people to be part of our organization. Right now, we're working on something that I'm really excited about and my board's supportive of, but that is stipends for student loan repayment. Seriously, the board is moving forward with their own monies to support the staff of Comprehensive to stay there and to decrease their student loan debt, and that's pretty impressive. We're also looking at daycare stipends, and we're kind of exploring partnerships with other community non-for-profits in the area and how we can partner to provide daycare for our employees. So there's a lot of really wonderful things going on.
There is. So definitely, if you want more information about comprehensive healthcare, you could head over to our website, kffm.com, pw.com. Jodi, thank you so much. You did fantastic. She said this is her very first interview, so let's give her a round of applause. She survived.